A very good evening from Dr. Archana Dwivedi, Committee Chairperson of Midlife Management Committee, Fogsi. It gives me immense pleasure to invite you to 292nd episode of our Gyan Pravah, which is highlighted and pioneered none other than by Dr. Sunita Tandulwadkar, Madam, our prestigious, why do I say? Because I don't want to call Madam just Doctor. She's Dr. Professor Sunita, ma'am, and I feel so proud to call her that way. Dr. Bijoy is here, two stalwarts who talk about robotics, who talk about innovations in laparoscopy, endoscopy. I feel I'm overwhelmed today to have two smiling faces in front of me. And Dr. Bijoy, let me tell you, Madam has taken up as our president in January. And since then, there's a song, I'm Unstoppable. I completely dedicate to Madam because whatever field you name in, she is there with excellence and excellence. I would like to just summarize in one sentence. It is very, very Suraj ko diya dikhane jaisa, but a journey to perseverance and perfection is like proceeding towards excellence, innovation, and service to humanity. That is what our Sunita ma'am is. And let me take the pride to tell when we are talking about laparoscopy that she was first in Pune to perform the lap hysterectomy in 1995 and 3D laparoscopy in 2013. And her robotics, tubal anastomosis,
you remember that?
Yeah, ma'am, I told you, I remember even that blue suits with the robotic thing. So that's one of the very fondest memory I have of Madam. She was sitting there and saying, see, I am not bothered that I'll age someday. It's going to be a fantastic journey always. So I remember ma'am like that to you. And she's also HOD of Ruby Hall Clinic and so many accolades. But what gives me a little extra boost whenever I look towards her is that her spirituality, a tint of humanity in everything, whatever she does. So I would not stand in between of two stalwarts.
Thank you, Archana. Today is your day with Dr. Bijoy. And thank you so much, Dr. Bijoy. 280 plus episodes every day, 8 p.m. From 29 Jan, we are meeting every Foxian. I have 30 chairperson and 30 days have been given to 30 people. And on 31st, whenever it is there, I do that with spirituality on lessons on Bhagavad Gita with Mr. Rohit Arora. So it's a really fun, but believe me, it has become more fruitful journey to me because every day I get to meet such a stalwarts in the field, whether academic or non-academic, non-medical, philosophical, spiritual, political, any background. And it's so much to learn through their journey. I join every day 8 p.m. just to show our respect to you. You are coming out, you are giving time to Foxy. We are grateful and we feel honored that you are with Foxy.
It's my pleasure.
Now, Archana is one of my very sensible, dependable, creative. She is always, I still remember somewhere in Kanyakumari or Coimbatore, Uti conference, people were saying in her menopause workshop which she has organized, I thought, menopause mein kaun log jayega? She had an overflowing. People did not have a place to stand and she makes them even do some dances and yoga and exercises. So in Pune, she just took 1 week ago, she asked me, can I do the menopause? I said, now all are working for it for last 6 months. She said, don't worry. I said, you are not scared that you may not get faculty, you may not have delegates. She said, I will have everything. So that's the confidence she shows.
Thank you, ma'am. I have you back always.
Yeah. So thank you. And I'm sure I joined on a viewer's link and will enjoy the dialogue between both of you and have a great time. You are going to speak on endoscopy, journey. I think what else I want really on endoscopy, some few of at least motivational podcasts so that many more will get stimulated with the same. Thank you.
All right.
Thank you, ma'am, for the words of wisdom. And let me tell you, laparoscopy has been very close to Madam's heart. And let me take the privilege to introduce Dr. Bijoy Thomas, who is a gynecological and oncologist and who is one of the highest volume robotic surgeons in the United States and internationally. He did his medical training at Baroda Medical College. That makes me more proud, and graduated in 1995. Went to do his residency in obstetric and gynecology at the world-renowned Mayo Clinic. and eventually did a fellowship in gynecological oncology at Mayo Clinic as well. He is a very busy practitioner. Thank you for sparing time for us with a high volume robotic surgeon who typically does 15 to 20 robotic surgeries every week. Now that's a number. And he has done approximately 5,000 robotic surgeries over a span of this 15 years of period. Dr. Thomas has also been professionally very prolific and has been a part of numerous peer-reviewed publications and multiple national presentations. He has been invited as a faculty multiple times for the renowned Society of Robotic Surgery, that is SRS, and has traveled internationally and nationally multiple times. Also is one of the surgical experts who helped with preclinical trials and launch of Medtronic Hugo robotic platforms in the United States and internationally. He was also involved in the launch of Medtronic robotic platforms at CARES Hospital in Hyderabad and Venkateshwara Hospital in Delhi. So Indian roots are always there. He also had a remotely help with monitoring surgeons internationally use of robotic platforms. Currently, Dr. Bijoy Thomas is a Chief of Gynecological Oncology at Lehigh Valley Health Network in Pennsylvania, USA. Dr. Thomas is also a professor in OBGYN at University of South Florida College of Medicine and also adjunct clinical professor of Jefferson University. Believe me, I made him cut short because the CV was endless and so many things was there. Thank you, Dr. Bijoy, for joining us. A very good evening to you. And it gives me a proud privilege to introduce you as a friend and as a celebrity robotic surgeon, I would say. So to start with, if I have to ask about your journey from medical school in India to becoming a renowned robotic surgeon in US, how was the journey like and how did you feel this transition completely?
So I had an amazing journey. I grew up in Gujarat, so I'm originally from Kerala, but I just met wonderful people throughout my life. I got into med school initially in Surat in 1990, and then I transferred to Baroda, and I had an amazing education. I'm very proud to be a graduate from Baroda Medical School, and I still believe that they train students extremely well. Students from Baroda Medical School are all over in the United States as well. In 1999, I got into residency at the Mayo Clinic. I then eventually got into a fellowship in Gyan Oncology. I spent 7 years over there. Again, I was blessed with wonderful mentors, world-renowned surgeons where I had the privilege of working with them. And then eventually, once I was done with my training, I decided to move to Philadelphia. I joined Temple University. It's a very high volume place where, I was doing very complicated gynecological oncology surgeries. As you know, the biggest challenge with cancer surgeries is the morbidity and mortality associated from the surgery. The complication rates tend to be so high just because of the nature of cancer and then older, sicker patients. So in about 2009, the robotic platform just started getting introduced in United States. And the biggest thing for me was the whole concept of it improving patient outcomes. So that was the main reason what kind of got me attracted to robotic surgery. And that's when I decided to move to Lehigh Valley Hospital. When we started doing robotic surgery, we had the Intuitive platform and we had the old Intuitive S robot. And my personal goal was that maybe 10% of my patients, I should be doing it robotically. And the hope was that this would significantly decrease the morbidity associated with oncological surgery. And then fast forward 15 years and the robotic platform has evolved from the S to the SI to XXI and now the Divinity-5. So we started off with just one robot, and right now we have 16 Divinity-5 robots in my facility. And at this point, I'm doing 99% of all my surgeries robotically. And over 95% of my patients, they go home the same day. And within a matter of a couple of weeks, they're pretty much back to normal. And then the main advantage is that if they need something in addition to surgery, like chemotherapy, radiation therapy, it's just a matter of a few weeks and we can get them started on it. So it has been quite a journey, and I'm proud to say it started all in Baroda.
I think you were drawn this passion. How did this come? This you said when you're talking long back when it was launched. Actually, not many people were like, robotics is not our cup of tea. It will take time to develop. So, what actually inspired you?
What inspired? So the whole concept, at first time when I saw robotic surgery, we all tend to be a little bit skeptical about things. We are trained in a certain way. So my one advice to younger people is to just keep an open mind. So there's always something out there which might have the potential of improving patient outcomes. So I'm like let me put one step and see if this may be the right thing for the patient. And again you need a very strong foundation, and I think that my background in medical school residency gave me a very solid foundation. And then I just wanted to take it to the next level, just keeping a open mind, just being a little bit more critical thinker, and that kind of got me launched into robotic surgery.
So I think that's a very good thing, that believe yourself. Until you jump into water, you're not going to swim, first of all. Second thing is that I can see a teacher hidden in you, a mentor hidden in you when you talk about this with so much of passion. So how do you see or how do you shape up your students or the surgeons who approach you to learn?
I do love teaching. And as you mentioned, I'm also a professor. So again, my passion is, obviously I'm a G1 oncologist. Women's health is definitely my passion. But again, I do have a passion for training. I train medical students, I train residents. I come across fellows as well. Then I mentor a lot of new surgeons. And then internationally, I also mentor people. So again, the main my whole philosophy is to help give a positive feedback and just create an environment, a teaching environment for my students. So the key is to have a very structured curriculum where your residents or medical students, they understand exactly what are the goals of the training. And then kind of having a very much hands-on approach means we do a lot of simulation. So we have simulators, robotic simulators. So, even before they can, start doing surgeries on patients, we do have a criteria they have to meet. They have to meet or become more proficient with the technology before they can jump onto the console to do the robotic surgery. And then stepwise, taking them from like simple procedures to something more complex, having them watch videos. So videos, even after doing so many surgeries, I love watching videos of other surgeons, their techniques, and you're always a student. You always figure out, someone has something better than the way you do things. So, always be a, eternal learner, always try to learn. And eventually, once they are credentialed and certified, I'm still always their mentor. So a lot of my residents have eventually become faculty at my hospital. And still, when they are in Vine 15 years later, they always would pick up the phone. They would like to talk with Dr. Thomas, and I'm always there to help them and say that, okay, I know you're doing well. Yeah, they just need me there just for moral support. So I'm always their mentor. So that's my whole philosophy. So
that passion shows when you talk about it. So I think that's a very good thing that you talked right now, that seeing the videos, there's a learning curve. Never you are perfect. There's from ordinary thing also you learn so many things to survive in your own techniques. That's a very good take-home message, Dr. Thomas. And how would you define the modern robotics? And how far has it evolved from the early industry, as you said, Da Vinci 5 years ago?
right. So definitely,
And any major advancements you see in the robotics, which is shaped in over the period of last decade, because over more than a decade you are into the same field?
Right. So again, the whole technology, so initially we just had one platform, the intuitive platform. And again, the intuitive platform went through several versions of upgrades. So it started from the S, and now we have the DaVinci 5. With every upgrade, you get better precision, you get better accuracy, better dexterity, better energy system. The good news is that now we have other platforms available as well. For instance, the Medtronic platform, that's one I was very much involved in, and I helped launch in India, and I was also involved in the preclinical trials as well. I believe Johnson and Johnson has another platform coming. India has its own mantra, which is amazing as well. So so again, more and more platforms are coming out, and the bottom line is that with every new upgrade, the goal here is to how best we can improve the patient outcome. So how fewer incisions you can make, how better the magnification becomes, how better the dexterity becomes of your hands. And then eventually the next phase is going to be AI integration, where, autonomous robotic surgery, like mundane tasks like, suturing or closing, it's almost like the machine you use for tailoring, just like that, it just sews up. So very similar to that, autonomous tailoring. That would be the next phase here for robotic surgery. So things have evolved and improved, and things are just going to get better.
So that's very nice, giving us a very hopeful and a very fabulous picture out there. By say 2050, I think we'll have all robotic integrated systems, which world will be looking.
Yes. Yeah.
With this emerging technology comes the cost factor, comes the regulatory policies. So how to evolve along with robotics to ensure safety, accountability, and also, a little bit of affordability, if you can guide us.
Right. Yeah. So again, so let me first speak about the affordability. So again, so I love the fact that, robotic surgery is just this amazing platform where we can help patients. And again, the cost becomes like a big prohibitive thing for worldwide application. And again, the good news is, competition is always good. So again, the fact that different companies are coming out and competing in this market, I'm reassured that the cost is definitely going to go down. Eventually, I think there needs to be some kind of partnership between, like, public sector, private sector, non-profits. Somehow they got to make this technology, adaptable worldwide, because, imagine like hundreds and thousands of women need hysterectomy in India. If we could just do it all robotically, we could be helping so many people get back to their normal day-to-day lifestyle. The other things which really make me optimistic about affordability is telesurgery. So we didn't talk a whole lot about telesurgery. That is also on the horizon, where, surgeons can remotely, log on, and, they can, just like, we are doing this Zoom meeting 10,000 miles, distance. We can similarly, just with 5G cables, we can do telesurgeries, or at least you can provide mentorship. As a matter of fact, I have provided mentorship internationally on live surgeries as well. So again, those are things which would definitely bring down the cost. The more we train regional doctors, that would make it more affordable as well, have more like regional maintenance, technology centers, infrastructures. So you do not need to export technology. That all, eventually will bring the cost down. Your next question was about regulations and safeguards. So again, definitely this is a newer technology. It definitely needs, someone to be trained and credentialed and certified. So again, you definitely need a regulatory body just watching over the credentialing part. Obviously with any technology, any surgery, there are risks. So, the surgeon has to be very proficient. There has to be informed consent. The patient does need to know that we are going to be doing a robotic surgery. And then, quality control is very important, where, there's a constant maintenance of the technology. And then if there's any adverse outcome, there has to be accountability and like, transparency where, if something bad happens, how we can make sure that it does not happen again and how do we become better from that experience. So, all that definitely is important because our goal is to provide the best care to our patients. And, so that's my thoughts on regulations. So.
Yeah, very well said. So I think the word that regional, more and more people, if they adapt the newer technologies, automatically it becomes into the affordable criteria. Dr. Bijoy, there is one word known as liberation. What does robotics offer to the patient and the doctor in terms of, especially when you're doing gynec onco surgeries? Because I think when I joined my institute, I felt that gynecologists are the most busy surgeon. But then it came out to be a fake concept because I thought oncologists are the better ones because they're operating daily. So the era is coming that way. So how do you find that liberation of with robotics will help our patients and doctors as well?
Right. So by liberation, I mean like how it's going to improve like access to patients, how it's going to help the doctors. So again, my hopes are just with the cost factor. Once the cost of the robots come down, it's going to give, access worldwide, help out our, patients all over the world. And I really would like to be a part of that liberation. I just would like to go back to my roots. So eventually I'm hoping that I would be one of the doctors who brings back the technology to India at some point. So that's my long-term wishes. From a standpoint of a physician, now doing robotics so long, I always dread going back to the old-fashioned way of doing surgeries. If you remember, oncological surgeries are long, gruesome surgeries, like 4 or 5 hours. And the older I get, my back hurts and my legs hurt. And, the one advantage of robotic surgery is ergonomically, it is much more, better for the surgeons where at least you're sitting down. Tends to be more efficient and faster too. So on a typical day, I would do like 6 cases. And these are oncological cases. I typically would start around 7 in the morning. And usually I'm all done by like 4 or 5 o'clock because, I got like 2 rooms going. I pretty much, get cases done, but it would be almost impossible to do like big open oncological cases, more than 2 or 3 a day. So again, eventually it's best for everyone. It provides liberation not only to the patient, but also to the surgeon. So it is best of both worlds. So
I think it looks very fabulous sitting in your room and sitting. Yesterday only we had a onco surgery combined with the onco surgery. I think it's 5 hours is always there.
yes, absolutely.
You are like compromising on so many things when you're operating. So
right.
Surgeon, plus I think the age also is no bar when you talk with robotics, right?
Right. So
Yeah. So
age gives you experience, but with age comes other issues as well. So yeah.
So maybe you will have extended arms to operate with your experience.
That's right.
So that would have been a better liberation for everybody. So if I have to talk about like rehabilitation specialist, are the robotic technique helping surgeons, nurses in that also? There are some ethical safeguards which should be practiced if we talk about the medical robots.
Ethical safeguards, yeah, absolutely. So and we talked a little bit about that. From an ethical standpoint, means you absolutely have to be proficient in the technology. So your surgical skills, the basics, what you have learned is not going to change, but robotics has a totally different set of skill sets. You need to be very proficient with the technology, and then you need a different level of hand-eye coordination. So it's not as intuitive as, when you're operating live, because for robotic surgery, I'm completely disconnected with the patient. Means patient is in one part of the room. I may be in a separate area completely. Means I do not have any idea what's going on. There's a bedside person. So you need a team. It's a teamwork. You need a very proficient team, and you need to be in a center of excellence. It's at the end of the day, robot is just a tool. You need to be the robot can provide you accuracy, can provide you precision, but the creativity, the critical thinking, you need a surgeon. So, and the surgeon has the ethical component where, we can decide what is good, what is bad. The robot doesn't have any sense of ethics. So, so at the end of the day, it's a good ally, but it's not a good master. At the end of the day, you need a good master, a good surgeon who can manage the robot, but it's definitely a good ally, a good servant to help you out. So.
Oh, such a beautiful description that brain is always going to rule over as a master. If you say you've got an extended arm to act, but our ethics, our basics, the surgical basics remains the same.
Absolutely.
Quite amazing. You said 6 surgeries in a day. That's quite amazing to understand that how robotics helps to cut short the time.
Absolutely.
If Dr. Thomas, I have to ask you interlude lucid type of a question that if you have to design a robot, what your future robotics would be and your concerns would be?
So again, if I was to design a robot, so again, a lot of the principles which I just mentioned, the robot has to be patient-centered, should be human-centered, where, the human is the person in control, where the human ethics, our understanding of right and wrong pretty much factor into everything. The robot will provide, the accuracy, will provide the precision, will provide the magnification, the dexterity, but the surgeon is the one who is doing the critical thinking here. As time goes by, AI is going to get integrated into the robot. So it is just a matter of time where autonomous surgery is going to be out there. But again, it should be under the control of the surgeon. If I was to design a robot, I would definitely want it to be cost effective, where I can allow the benefits for a bigger population of patients. So again, that would be something which would definitely be in my mind. So again, there is always a balance of, private sector as well as non-profit, and we definitely love our private sector. So again, something which we can help out our community, that would be the goal from my standpoint. And, the other advantage of AI is that it also opens up a world of virtual interface where, young people, they can always get virtual training. So I think NVIDIA has like something called a digital twin. So you have a patient, and then it can create like a virtual patient where you can practice doing surgery before you're really doing surgery. So that definitely would be part where it can enhance training, provide feedbacks. And then one other concept with AI is that it can give you live feedbacks during the surgery. So for our surgeries, for instance, if you're coming too close to the ureter, you're coming close to the iliac vessel, it's almost like giving you live feedback, trying to get you away from harm's way. So live feedback, and then personalized treatment. So, we all are very similar, but we all are very different. So everyone is very unique. So again, it would kind of be very personalized to every single patient. So that's what I envision as well. Right now, robots are big and bulky, pretty much taking up the whole operating room. I'm hoping over time they become more miniaturized, they become smaller, where, they're not taking up that much room, and they're more, accessible. They're even talking about things like microbots and nanobots, which they inject into the bloodstream, and they will be taking care of all kinds of different diseases. So it's going to be an amazing world 15, 20 years down the road.
So I think 2050 will be AI integrated systems everywhere. So I think we'll have robots we navigate in the cars and all, like the reroute and come back with a possible shortest train. So probably if you're near the ureter, you're not to be worried. There will be a beep beep, go on the left, go on the right, and then it's going to direct you the way.
And believe it, the technology is out there, it's already out there. So
maybe the next podcast we'll be having that navigation with the AI robotics sometime. We as a laparoscopic surgeon, Dr. Thomas, have a learning curve. There's a learning curve, there is adaptability, design also does matter. So what do you feel that this learning curve comes easily to the robotic surgeon, or it also takes the same passage of time? Because maybe you're having a robot to operate, but the commands is from your side.
So definitely there's a learning curve. I would imagine that from laparoscopy to robotics would be a easier learning curve. In my journey, the place at Mayo Clinic where I trained, they were pretty much doing all open surgery. So for me, the transition was straight from open surgery to robotic surgery. And again, for me, it was not a difficult transition because the bottom line is the principles of surgery always stay the same. Technology changes, but the principles always stay the same. You have to become proficient with the instrument. You have to understand a different set of hand-eye coordination. I would say that my first 100 cases, I was more cautious. It was taking time for my muscle memory to develop. After that, you will notice that there is a significant increase in your efficiency and your way of doing surgeries. And then after your 1,000 case, yet again, it kind of goes exponential. And I think that once I hit my 4,000th surgery, then afterwards it just became almost like a subcortical thing where I almost have the muscle memory, like almost like breathing, talking, where I really I am paying attention, but my hands are pretty much doing everything. So it almost becomes like a second nature to you after you reach a certain threshold. So
I think more you do, more you learn, the more your body becomes adaptable. It's like
yes.
making yourself understand that you are born for this and you are doing it with most specific accuracy without harming your patient or yourself as well.
Yes.
So I think you have very well described that integration of AI is going to increase the capability of robot. So what does a basic surgeon need to, I'm just diverting a little bit on the topic, that do they need to be ergonomically very sound, or they need to exercise some parts to be more integrated into robotic system, or it's like just sit comfortably and go ahead with that?
It is just sit comfortably, miss, any surgeon can become a robotic surgeon. Means there's nothing spectacular. Just have an open mind and just be open to learning new technology. And the goal is just to be a constant learner, and and never be shy to try something different. So there's we love our traditional way of medicine. It taught us all a lot, but again, we can always build up on that foundation. So there was a famous scientist, Isaac Newton. He said that the reason I can see so far is because I stand on shoulders of giants. Yeah. So Baroda Medical College was the giant, and I'm standing on the shoulder, and then that's the reason I can do what I can do.
So sweet of you for remembering it, very fundamental, I would say, because foundation yet that it matters in every field. Why talk about medicine only? And there's an innate strength which comes to you, a dare which comes to you when you have a better basics. So yes. I think the young innovators who are aspiring to be a robotic surgeon, anything you want to just add on at this point of time?
Just like, as you mentioned, work on your basics. So if you're an innovator, if you're in, like engineering, get your basics. So in America, there are the basics, so we call them the STEM. So science, engineering, technology, mathematics. So have those basics. So, and we all get a really good education in India in high school, and school system is really good. If you're in medicine, if you're a medical student, then work on your basics against your anatomy, your physiology. Those are the foundations. And then, always, if you're thinking about being in robotic surgery, always look for a robotic community. Look for like workshops, look for conferences where you can just better yourself, journals. And then, as I mentioned, videos. I have learned so much by watching videos of other surgeons, doing things, and just sometimes, seeing them make mistakes, and sometimes, and sometimes I watch my own videos as well. So again, I learn by even going back and rewinding and looking at my own videos as well. So that's my advice.
Robotic surgeon talking about intro, meditation, and going back to the things and learning the basics all and over again by seeing yourself. That's very true, Dr. Thomas, because once once you go into the surgery, before that you have to operate in your mind itself. What are you going to navigate there inside?
That's right. Absolutely.
I think sometimes in dreams also we are doing that breach and that manual rotation, everything when we were resident before actually we were going to deliver somebody. So that's what goes as back of the mind, that you have to be well prepared. A thorough knowledge of basics is really, really very important. And as you said, anatomy is going to be your domain always when you're entering to, especially when an onco field you're there. I still remember when I was entering that corona mortis, this is the ureter, this is everything. It came out so flash, but actually once go inside, you see the practicality.
Right. Yeah.
A little more here.
Yeah, and the funny you mentioned about corona mortis. So, just for our, audience, it's like
I deliberately did that, Dr. Thomas.
It's a abnormal vessel which comes from the iliac vein, and it's surgeons always would get into it and get into massive hemorrhage. The beauty of the robot is that space, it's called the obturator space. You can zoom in the camera and you can see that space, and you can clearly identify the corona mortis, the obturator nerve, and all that. And, when you're doing an open surgery, especially if you've got a heavy patient, it is so difficult to, look into the pelvis, and then you've got like 6 people standing around you, and then, you're looking inside, and God forbid, if you get into bleeding, it is extremely difficult to control it. So again, the robot was a godsend for corona mortis. So it definitely took, I have not gone into those bleedings, with robotic surgery. So
that's the beauty. That is why I deliberately mentioned that word, because when we are studying, like you said, you're not peeping inside the surgeon. The mentor is also wanting to show so much, but he himself is trying to focus. And when actually the onco patients or the gynecostectomies come to us, we already have a apple-shaped body, a tendency to be on the oversize. So it's really, really difficult. With robotics, I think that is easy to access.
Yeah.
So that gives us an extra boon for having that Zoom videos, I would say.
Absolutely.
Any funny, good experiences you would like to share at this point of time? That's always a question I give it to everybody. That comes out of the moon and hits you somewhere, that you did something special and it's still registered with you.
Well, nothing comes to my mind. I had the chance of taking care of hundreds of patients over time. I do like to keep the atmosphere in the operating room very funny and, calm. So in general, in my operating rooms, people are always joking and having a good time. So it just creates a good learning environment for everyone. So it is fun. I enjoy what I do, and I just like to be kind to the people I interact with, and usually my staff, they always, if they have a choice, they always pick me. They love working with me. So
that's so kind. I mean, that's the thing which you talk about, the teamwork, because
yes,
very very apt. It has to be a atmosphere thing when you look in the eyes and people know what you want and has to be done.
Absolutely.
That's a very very important thing.
When I have to say anything, they know exactly what you want. So yeah.
So having a good team is always the first aim whenever you are setting up any robotic or a laparoscopic team, because without them you are nothing actually.
Right.
You're a master behind the thing, but they are your assets and you should grow them, groom them in a way.
Absolutely. And I always give them credit. So yeah. So
that's very kind of you, because giving credit is something which I feel that we should always keep on showing the gratitude. That gives them extra boost, that you belong to them and they are there to work for betterment of the patient, rather, I would say. So how, like you said already, improving the skills is very, very important. So as a mentor, if I have to give you like 10 commandments or 5 commandments of mentoring yourself in a better way, what would be your advice to the summing up? You have already said many things during the talk.
Yeah.
Yeah.
So, definitely find a good So if I had a young surgeon who was interested in robotics, so definitely find a good place, find a good mentor. So you definitely need mentor. You need someone to watch over your shoulders and kind of show you the path. You always would want a structure. So you just don't want to be aimlessly just spending 6 months or 1 year just to get a certificate. You need a structure. You need self-motivation. So a lot of learning robotic surgery involves simulation, where you are sitting late hours on the simulator, so where you're kind of trying to use different instruments, becoming proficient with the technology, watching a lot of videos, and then eventually, when you get into the live case situation, you can, flourish in that situation. So a lot of mentoring, a lot of, self-motivation. Once you get credentialed and certified, you need case volumes. So, you can't be just doing a case every month and then expect to be a good robotic surgeon. So, and then try to push the limits. So when I started, my goal was just 10% of my cases should be robotic. And then I'm like, why not 20%? Why not 50%? Why not 90% of my cases? And, any young surgeon comes and, wow, oh my goodness, I don't know. Maybe I should not be doing it robotically. I'm like, what is there to lose? You're making 8mm incisions, you're putting a camera. The worst would be that you decide, well, I just need to convert and do it an old-fashioned way. So just, push the limits a little bit, little by little. And next thing you know, that you're advanced ovarian cancer, you're going in robotically, you're doing it. I just did one yesterday, went home the same day, so we were able to do upper abdominal pelvic surgery and blood loss 5 cc's, 5 mils, and she's home. So yeah, so that's my advice to young upcoming surgeons.
That's very good. You came up with a very good point, blood loss. So in all the surgeries, effectively, the advantage patient has more over the open surgeries. One, you said blood loss, time is less. What else we do have in our kitty?
Good question. So, we are working through little tiny incisions. Blood loss is minimal. The trauma is minimal. Pain is not a big issue after robotic surgery. Most of our patients just take, paracetamol or NSAIDs. Most of my patients, they go home the same day. When they go home, they can walk, they can climb stairs, they can take a shower, they can take care of themselves. If they drive in 2 or 3 days, they're able to drive. I do tell them to be as active as possible, because as you know, with gynecological surgeries, we worry about blood clots a lot, DVTs. So we always want them to be up and around. I tell them, go to the mall, go to the grocery store. The only main restriction is not lifting anything super heavy, nothing more than, I would say, like 20 pounds. And that restriction is for, I would say, like a month or so. But other than that, I just want them to be back to normal as soon as possible. So it's totally a paradigm shift when it comes to postoperative care, where you back in the day, you would have a big incision, you would be in the hospital 4 or 5 days, 6 to 8 weeks recovery. You're now going home the same day. You're not on hardly any medications. And within a matter of few days, you're just driving, you're doing your normal grocery shopping and all that. So major paradigm shift, and surprisingly, patients do extremely well. So
I think that's a very good point, Dr. Thomas. You're pointing that when you respect the tissue is going to respect you. So probably over dissection, over stretching, and like maybe we are overdoing sometimes when we are doing it manually. But
absolutely,
it becomes a precision to dissect, and you are at the point. And probably if I talk about lymph node removals, I think you feel it is more precise, more accurate, because
absolutely. So what I do is something called sentinel lymph node, where we inject a dye. It's called indocyanine green into the cervix. the dye precisely will track to just one lymph node on the right side and one lymph node on the left side of the pelvis. And for all my cancer patients, typically I would just remove the sentinel lymph nodes. So back in my training days, when we used to do a complete radical lymph node dissection, almost like 25-30% of patients would end up developing lymphedema. And then it affects, quality of life and, self appearance, self-confidence. You can't wear shoes and all that. So again, from a quality of life standpoint, this has been a game changer. So precise. You're just precisely just affecting one lymphatic channel. I've done thousands of sentinel lymph node dissection. I have had zero lymphedema. I have not come across a single patient with lymphedema. So
I think that's a very good technology. We are practicing definitely in India, many of the institutes in our institute also, but with robotics, I think becomes the precision of the surgery is something which is
precision is phenomenal. So
unnecessary rubbing the vessels or the ureter, pulling more of that. So how about the ureter? Is it always forgiving in robotics also, or you have a chance of injuring it somewhere? I mean,
well, again, at the end of the day, you need technical surgical skills. So again, one thing about robot, as you mentioned, we use a lot of energy sources. So we are not doing a whole lot of blunt dissection. So again, so you have to be very careful with energy sources, monopolar and bipolar energy. Now, you can give very short bursts of energy, but in like prolonged bursts, you do not want to do it because now you're going to get collateral damages. But you can very precisely just mobilize the entire ureter from the brim all the way up to the bladder, and with literally like no blood loss. I mean, it looks almost like a Netter's diagram from your anatomical atlas. So so again, Miss, you always have to be cognizant. You have to understand, respect the structure. You need to respect tissue, respect the ureter. But again, you have to be very cognizant, how much energy you use. So I have, again, I say my prayers before every surgery. I have not had any major issues with ureters. So, yeah.
What else? Another is vessels when we talk about. So ureter, we are already touched. So vessels also, what utmost care do you think you should take when you're a robotic surgeon out there?
Yeah.
The hand is not there. It's somebody else is operating for you. That's what a layman would think.
Yeah, so it's again, that definitely is a misconception, even in the States that, the patients think that, oh, so you are not doing the surgery. So, I always very kindly just explain to them that, it is actually, I'm the one doing the surgery and the robot is just helping me to see things better, is improving the precision and accuracy. So, so the vessels always, pelvis is a landmine. You've got this major blood supply, you've got the iliac vessels, the external and the internal iliac vessels, and all the branches, the uterine vessels, the bladder branches. So again, the robotic approach does give a good exposure in the retroperitoneum. And again, as you know, the pelvis is a cone-shaped structure, which standing and doing an open surgery is very difficult to look at the pelvic side walls because you're just bending your head. As you mentioned, there's 6 people standing. Your mentor is trying to show you things, and then the angle. If you, God forbid, get into bleeding, it's such a difficult angle, especially if you've got a obese patient. So again, the robot does give you, number one, it helps prevent any kind of major vascular complications happening. And then if, God forbid, if you did get into any kind of bleeding, and again, I say my prayers before every case. I never had to convert a case for vascular complication just because I can see things so much better robotically, the key is just staying calm and, getting one extra port, applying pressure, just going back to the fundamentals, just applying pressure, waiting, get another port in, get another suction in, and then, just compressing the proximal flow, and then just you identify it, and then take your time, take a couple deep breaths, and then, you can put a clip, put a stitch, and take care of it. So again, it prevents, in my opinion, prevents any kind of major vascular injuries. And if there is, it definitely is a better option. Your gut response is that, well, let me convert. but it would take almost like half an hour to, convert and make incision and go down into the pelvis. Within a matter of a few minutes, you can just fix any kind of vascular complication. So
I think that's like typical anesthetist. Wait for 5 minutes, do nothing, press, it will come.
yes,
So
it is good advice.
yeah, and sometimes actually when we were resident, they said, don't do anything, just stand there. I'm watching time for you. So that was something which actually taught you the basics, that sometimes you have to just be calm, and the 2-3 minutes are required to build up back.
Yes, calm surgeon. Yes, yeah. Don't overreact. Yes.
Yeah, calm is very, very important thing when you are having a field full of blood vessels, nerves also. I would like to just you to touch that genitofemoral and other things also are there. The obturator is there.
Right.
We decide the end point is here, and all those triggers which happen.
Right. So again, for lymph node dissection, as you mentioned, ilioinguinal nerve, the genitofemoral nerves. You always want to identify that, and then you got this obturator space where you got this nerve called the obturator nerve, which affects the adductors of the legs. So that was one a frequent complication of open surgery, that you would avulse or injure the obturator nerve, and then patients have difficulty with adduction of their legs. So fortunately, you can clearly identify, open up the paravesical, the pararectal spaces, identify all the structures, identify the anterior division of the hypogastric, so if you're in any kind of bleeding, you can just ligate the anterior division and it pretty much takes care of everything. So that is definitely the beauty of robots. I'm learning more about anatomy now than when I was in my first year medical school. And, in live patients, you can see anatomical structure so much better than in cadavers. So, it's always a learning, so I'm learning more about anatomy now than I did back then. So
I think it's like a joke was there that you are engineering operating with the heart working, and repairing machinery is much important, but with somebody's heart pumping and you're operating, it gives you an extra responsibility and extra adrenaline.
It does. It sure does. Yeah.
It was really a good talking about the last few questions, where actually I was feeling that goosebumps. I'm into the vessel, I'm into the nerve, I'm into the ureter around. So all those things keep on flushing when you go inside the abdomen, especially when you're open surgeon. And a little bit on the laparoscopy side also, because the zoom which you get in the robotics, probably we still need to be more careful as a general laparoscopic surgeon.
Right.
Coming to the fag end of our talk, probably I would like some good take-home messages for the people who are still fearing, still not able to come out, that they should explore their horizons to be a better robotic surgeons, because near future, I think we have got robotics in each and every field. Even the hotels are restaurants where they are popping up everything for you. So
that's
over to you, sir.
Yeah, technology is inevitable, miss. It is definitely going to be the next phase of surgery. So you just have to get on board with robotic surgery. Just, be flexible, be open-minded. I know that in India, you have a very strong basics, your fundamentals are phenomenal, and I know that, miss, taking it to the next level, it's going to be very, very easy compared to other places where you do not have strong foundations. So again, it's just a matter of, just taking the next step and being open and just finding the right mentors, and, you are going to excel in robotic surgery.
Thank you, Dr. Thomas, because I really keep on admiring that you being a mentor still try to tell that learn, and learn. That is very good, and you yourself are doing that practice still yet after say 15 years of practice and so much of huge surgical experience what you have. So I think medical technology is developing at a lightning speed. If you don't catch, not everybody, you'll feel left out some or the other time.
Behind, yes, that's correct.
So I think right now we're talking about robotics still shaking somewhere, whether maybe we are meeting 10 years down the lane and we'll have something more to talk about, something more coming in. As you said, capsules are there are so many things. Some
Right.
also say that operation is going to be an obsolete thing. There would be medical treatment for everything.
Yeah.
So I think I fantasize a robotic surgery in a way that you always remain forever young, physically and mentally.
Oh, wouldn't that be nice? Wouldn't that be nice?
So
Yeah.
that's what robotics gives to us. Thank
Yes.
you, Dr. Vijay Thomas, for taking out time
It
for
was
us.
such a
And
pleasure.
any beautiful punchline you remember for all of us before we end this session?
Any punchline? uh,
I mean, go home, start learning, start thinking about robots, something like that.
yeah, yeah, yeah. Go home and think about robots. So yes.
So being advanced is always a good thing. So being a mod in medicine is something which we are looking forward to. So this was a discussion with Dr. Vijay Thomas on futuristic things when we see through the robotic angle. Thank you so much for being with us, and I'm very thankful. Gratitude to Sunita ma'am for giving us this open platform. And really, I had too many merits to my kitty today when I was discussing with you, Dr. Vijay, and probably if I am a mentor to somebody, I'll take care that I am learning more and more every day of my life. So thank you for sparing time. Have a very nice evening ahead, and we'll connect some other day as well. Thank
Okay. Yeah. What a pleasure. Bye-bye.
Bye-bye. And thank you, support team, for being there with the silent support of yours. So bidding you all good night, Shabba Khair. Enjoy your evening ahead, and keep thinking, keep provoking yourself in the want of knowledge. And believe me, Dr. Vijay is there to advocate that you're not going to suffer, you're going to excel only. So namaste and good evening to everybody. Bye for now. Thank you.